Well, cervicals are a little different than lumbar. First, we're usually doing anterior interbody fusion, so you're looking right at the end plate. So curette in that area is pretty fine. But what I like to do is put the shielded footed Dreal burr along the posterior end plates, and I can easily and quickly decompress the end plates that go into the spinal canal. The burr protects me from the spinal cord, so I don't wrap it around a burr. I can go from the midline all the way out into the foramen and get the uncovertebral joints completely decompressed, opening up the foramen. I can do that really quickly, and we're talking less than a minute. And I can do it on both sides of the disc at the end plate of the vertebral body below and above, and I've done the foraminotomy as well as the central decompression. And I've preserved most of the end plate by doing that. So then I have a really good space to put an interbody cage or graft or anything I want to put in there. So I think it's really helpful.
In the cervical spine, if we're doing corpectomy work or working in areas where just a small amount of dorsal bone is required to be resected within the spinal canal, this allows us to avoid, for instance, doing a 2-level corpectomy. We can do a 1-level corpectomy and use this sort of technology to shave down that dorsal bone, make room for the spinal cord, but leave the structural component of that adjacent vertebral body, rather than having to take it as we currently or historically had to do, and that creates a long reconstruction with more risk of failure structurally.
Recently I had a young patient who had a pretty significant dorsal osteophyte, but the rostral disc was very healthy, and so using the Dreal, I was able to get underneath that dorsal osteophyte in the cervical spine vertebra and remove it without having to do a full corpectomy. I was able to just do a partial corpectomy and preserve the disc space above. So the nice thing about the technology is it's not just one drill, it's a number of different attachments that can kind of be mixed and matched to fit whatever anatomy or any anatomical challenges that the patient poses.